I'm Dr. Sarah, Staff Veterinarian with Trilogy International, and today I'm going to be talking to you about how to deal with emergencies. Pet emergencies can be very stressful for both you and your pet, but it may help you to remember that the majority of emergency cases seen in private practice end up being relatively minor and easily treatable. Having said that, it is very important to be fully prepared in the event of a life-threatening emergency. First, keep emergency numbers such as your local veterinarian or a 24-hour emergency clinic in a conspicuous place, and let everyone in the house know where this information is located. Get precise directions to the veterinary facility and make sure to know the route beforehand. Keep these directions with the emergency numbers. Maintain an inventory of basic first aid supplies. You can find a link to a list of suggestions in the blog entry that is attached to this video. Another useful item to have around the house is something that can function as a backboard in case your pet sustains a spinal injury. You can use a table, leaf, or an ironing board. If your pet is dragging its hind limbs or having difficulty standing, a spinal injury is suspect, and the pet must be firmly immobilized to prevent further injury. If your pet sustains such an injury, he may be scared or aggressive, so move cautiously and speak with a steady, soothing tone as you transfer him to the backboard. To immobilize your pet and prevent him from falling off the backboard when you lift it, consider wrapping both your pet and the backboard in a sheet or a long towel. In all likelihood, you will need help moving a pet with a spinal injury. Just getting him into the car can be difficult, so ask a friend or a family member to be your standby help should the occasion ever arise. If an emergency happens, call the veterinary facility first and describe your pet's illness or injury. If you do need to take your pet in for treatment, this will give the clinic time to prepare for your arrival, and you may get additional information on specific first aid or how to transport your pet. If you suspect that your pet has eaten something poisonous, bring the packaging or a sample of what your pet ate with you to the vet. This will give the veterinarian information on specific treatment for your pet. And this almost goes without saying, but please drive carefully, or get a friend or family member to drive you. If your pet is unconscious, position the head in normal alignment with the rest of the body. Do not allow it to flex upward nor extend downward. Improper flexing or extending of the head can decrease blood drainage from the brain and can cause serious injury. If your pet is vomited or is likely to vomit, position the head below the level of the heart. This will allow vomitus to run out of the mouth and not down into the windpipe and lungs. And please be aware that pets with severe head injuries are more likely to vomit, even when they are unconscious. Small dogs and cats should be transported in standard plastic or cardboard carriers. It is simply the safest and most comfortable way for them to travel. Large pets should be transported in carriers as well, if at all possible. Remember, sick or injured animals can be frightened or painful, and even the nicest animal can bite or scratch. So keep yourself safe by using a muzzle when handling an injured dog. Alternatively, small dogs and cats can be wrapped in a blanket. Do not leave a muzzle on a vomiting dog. They can inhale the vomitus and develop severe pneumonia. Blankets should be used to cover sick or injured animals. Blanketing is not only important for retaining heat, but it also has a calming effect. Do not force your pet to eat or drink, and above all, stay calm. Don't panic. Remember, with proper knowledge and preparation, you can increase your animal's chances of survival in case of an emergency. Thank you for watching, and check back soon for more episodes of Pet Talk with Dr. Sarah.